Oh, what a moment it was last night. And it was that, as we keep saying, sort of a collective moment of shock. And it really was, I think, last night at 6 o'clock. It was not what I was expecting. I thought we were going to be told, because of all the speculation as to exactly what the problem had been.
Yeah.
Not what we eventually found out.
No, I don't. We weren't prepared for that at all, were we?
No.
And people have different ways of dealing with it as well. Sally's been in touch, Morning Sally, saying, thank you for saying don't lay flowers. She said, when I had cancer 22 years ago, it was very distressing when people sent me lilies. People do things in different ways, don't they?
With that, I just think you need to go, well, people are showing their support in whatever way they think they can.
They're showing love, aren't they?
Yeah. So, I mean, I know I was a bit like that when Cameron was showing us the flowers left at Windsor Castle. She hasn't passed away.
No.
However, if it's how people can show their support, then you've got to let them do it.
All right, how about this one then from Christopher? Morning, Christopher. He said, Kate's strong power of mind will help her get better. I was diagnosed with testicular cancer, aged 28, and the doctor said there was a good chance of a full recovery, and I told him, that's me, I will be one of the survivors. So through the power of a powerful mind and belief, I recovered. I've gone on to have 2 beautiful children. My career thrived, and I'm now 60 and still physically fit.
Yeah, good on you.
Brilliant.
Good on you. Now, let's talk to NHS Doctor, Dr. Frankie Jackson-Spence, who joins us now. Good morning to you.
Good morning.
How important is it for Catherine to show her support, in a way? Because a lot of what you deal with people when they're going through something which may be cancer, as you've got to look not only at the medical side, I guess, but also at support structure and everything else for these patients.
Yeah, absolutely. I think it's, something that affects people's entire lives. It's not just how the cancer and the symptoms of the cancer, or indeed the side effects of the treatment, may make them feel. It's also the disruption to your normal life, having to go into this new environment and have hospital appointments, and kind of that disruption to your routine and your daily life as well. So I think support is needed for every part of the cancer journey.
Because it doesn't just happen to you, funnily enough. You're the one who maybe has had the diagnosis, but it does affect your family, your friends.
Yeah, I think it affects, your ability to show up in all different types of relationships. And like these viewers have been saying, everyone worries, don't they? We all assume the worst, and actually it affects everyone in different ways.
How common is it for... Because it's happened actually to both the King and now the Princess of Wales, that they've been told their cancer, they're non-cancerous in whatever treatments, whatever problems they've got, but then it's that post-op testing which has then provided the worrying news.
But doesn't it just highlight the importance of that early diagnosis and picking up on symptoms early? Cancer, unfortunately, will affect 1 in 2 of us in our lifetime, and that's probably only going to increase as we have an ageing population and we have more advanced diagnostic techniques, so we get better at picking up cancers. But we know that the earlier you pick up a cancer, the better the outcomes. And so I think this really highlights that anyone sitting at home with niggling symptoms or putting off going for a cancer screening programme, actually, we can hear positive stories if you do go to them and pick it up early.
And maybe not just thinking of cancer screening or something, but actually going to your doctor with all sorts of little niggles and worries that you might not think is cancer at all, but can sometimes show up. I mean, the worry, I think, with most people watching at the moment is to say, can you get to see your doctor about small things?
Yeah, I think that's a big comment that's going to come back off this, is people saying, well, it's easy saying that, but it's difficult to get an appointment. Difficult doesn't mean impossible. It might be that you have to wait a little while, or it might be that you have to do something like a telephone call, but you can certainly make contact with a healthcare professional. It doesn't always necessarily have to be a doctor. It could also be, another healthcare professional as well. But that shouldn't put people off reaching out.
Now, we don't know exactly what is wrong with Catherine, apart from it's something abdominal. All right, and that's where she wants to leave it, and that's absolutely within her right. But it can be embarrassing, doesn't it? Not that I've ever had to go for a smear test, obviously, but, women have got smear tests, men have got prostate checks. There was the Charles effect over prostate, wasn't there, which was very important. Christopher has just been in touch, testicular cancer. A lot of these things are what we would consider embarrassing to go to a doctor with initially. How do you deal with it when someone goes in with a very personal problem like that? Does it faze you at all, or have you just seen it so many times?
I think it's funny because we think these topics are embarrassing as patients because they're things we don't talk about often. So it's taboo subjects and you might feel a bit of embarrassment or shame around them. But for doctors or nurses or any other healthcare professional, this is honestly our day job. We see it all the time and it isn't embarrassing. Doctors don't care what you look like or anything like that, things that worry people. It's honestly things we see day to day. So please never think that your doctor's ever going to judge or anything like that. It's really not embarrassing for us. We see it all the time.
Yeah, it's just as a patient, you've sort of got to get through the door.
Yeah.
Yes. Interestingly enough, someone said to me quite recently that there was a chance they would have to go for a colonoscopy, and their concern, anything else, was that, well, my bottom's a bit big.
Oh no!
But that's not going to matter, is it? No one's going to think about it twice.
Honestly, we're not thinking about things like that. And I think, one thing that my advice would be is to voice those concerns to the healthcare professional, because often they will put you at ease. Or if someone's worried, you mentioned a smear test, about it being painful or not knowing what to expect. If you voice your concerns, the practitioner is going to talk it through with you, and that often eases the anxiety.
Because you have to remember they've done it a million times.
A million times. And I think often what we have in our head is worse than what it actually turns out to be.
Yeah. Well, it's worth remembering. Frankie, good to see you.
Good to see you.
As always. And do bear that in mind, because if you're thinking... And this is the chance, like we saw with the Charles effect, with men making inquiries about prostates, then large prostates that he was going in for treatment for. It's embarrassing. It can be a bit concerning, but don't be embarrassed. You've just got to go. You've got to take that first step, because it's better to have things sorted out than left.
Yeah.
So, and Christopher with his testicular cancer at 28, heck, that must have been embarrassing.
Oh, yes.
For him to go, got to face it. And then here he is at 60, physically
Two beautiful
fit.
children, physically fit.
Yeah.
He's beaten it.
So there you go. That's a positive message for you. Be brave, especially the gentlemen, because I think we're worse than women.
Hang on. Why especially the gentlemen?
Because men are worse at going to the doctors and things than women, aren't they? Is that a fair point, Frankie?
I think women are much more likely to, talk about an embarrassing symptom with their friends over coffee and therefore more likely to go to the doctor. Men definitely do bottle things up a bit more.
Yeah.
That certainly was the case with me. It was talking to my sisters and my best friend. They made me go to the doctor.
Yeah.
Whereas men don't talk about things like that, do they? No, they just talk about, whether Arsenal won at home last night. Doesn't get you anywhere.
No, it doesn't.